Your Eminence Metropolitan Nicholas, Chairman Sandikos, Chairman-designate Vasiliou, and fellow Leadership 100 members. It is my pleasure to introduce you today, one of our communities and one of our country's finest. A woman who, as you'll hear in this introduction, has dedicated her life to public service, spending over 3 decades directing programs in both the public and the private sector that have a significant impact on the life of individuals. Sylvia Mathews Burwell. On June 1st, President Burwell became the 15th president of American University in Washington, D.C., and the first woman to serve as president of that university in its 124-year history. Immediately prior to this appointment, President Burwell was Secretary Burwell, serving as U.S. Secretary of Health and Human Services from 2014 to 2017. There she oversaw the management of 77,000 full-time employees and the management of several agencies and programs, including Medicare and Medicaid, the National Institutes of Health, the Food and Drug Administration, and the Centers for Disease Control and Prevention. Under her leadership, the department shepherded the implementation of the Affordable Care Act, pioneered groundbreaking advances in research and innovation, and expanded critical services for children and families. Before she was Secretary Burwell, she was Director Burwell, serving as the Director of the White House Office of Management and Budget from 2013 to 2014. The U.S. Senate vote on her nomination was 96-0 in confirmation, and she was only the second woman in U.S. history to serve as director. There she ran the largest office in the executive office of the president, whose most prominent function is to produce the president's over $4 trillion budget, as well as measure the quality of agency programs, policies, and procedures. Sylvia's government service began in the 1990s in the administration of President Bill Clinton. There she rose from the National Economic Council to the Chief of Staff to the Secretary of the Treasury to one of 2 Deputy Chiefs of Staff to the President of the United States. And guess who was the other Deputy Chief of Staff at the time? Her fellow Greek-American John Podesta. She was then selected as the Deputy Director of the Office of Management and Budget. Between her public service to our country and the Clinton and Obama administrations, Sylvia spent 14 years serving our country and the world at 2 of the most impactful philanthropic organizations. She began in 2001 at the largest philanthropic organization in the United States, the Bill and Melinda Gates Foundation. There she rose again from Executive Vice President to Chief Operating Officer to President of the Foundation's Global Development Program. This program focused on combating world poverty through agricultural development, financial services for the poor, and global libraries. As a result of this work, in 2005, Sylvia was chosen by the Wall Street Journal as one of the 50 women to watch worldwide. In 2012, she left the Gates Foundation and became president of the Walmart Foundation. There she led efforts to fight hunger in America and empower women around the world. During her tenure, the foundation surpassed $1 billion in total giving. She earned a bachelor's degree from Harvard University, a BA from the University of Oxford as a Rhodes Scholar, and believe it or not, Sylvia's accomplished all of this in her first 52 years. So the best may be yet to come. And Sylvia, as those of us who ran with Sylvia this morning, the Leadership 100 run, as those of us saw, Sylvia is also quite the athlete. She was a basketball star in high school and lettered in basketball at Oxford, where her coach was none other than former National Security Advisor Susan Rice. And just 2 weeks ago, she was asked to utilize this basketball experience for her university when she was the guest coach at the American University women's basketball team. And it should be noted, Sylvia is undefeated. She's 1-0. She is a native of the small town of Hinton, West Virginia, population 2,469. And with her own Michael Psaros and his family is a proud West Virginian. Both sets of her grandparents immigrated to the United States from Greece, Sparta, Zakynthos, Emia, and Athens. Her mother, Cleo, was a teacher and mayor of Hinton, West Virginia for 8 years. Her father was an optometrist who presided over the local Episcopal church when there was no minister. She and her husband, Stephen, are the parents of 2 beautiful young children, Helene, 10, and Matthew, 8. In 2015, Sylvia received the Huck Leadership Award recognizing outstanding mothers and public service. And coincidentally, this award was presented to her by a woman who spoke at this forum just a couple years ago, the founder of the Hellenic Institute, Nitsia Logothetis. Ladies and gentlemen, please welcome President, Secretary, Public Servant, Philanthropist, and Mother, Sylvia Mathews Burwell.
Thank you so much, Mike. I think that partially just reflects that I can't hold a job. Your Eminence and the leadership of Leadership 100, thank you all so much for having me and inviting me to join you today. And today, I'm humbled, and I want to thank the Leadership 100 for the honor that I will receive of the Archdiakonos Leadership 100 Award for Excellence. And I will continue to strive to live as the Archbishop called us to live. He said, quote, "Our church," he said, "must remove itself from the sidelines and place itself fully in the center of American life." And Archbishop Iakovos believed in an active faith, closely tied with an active civic life, a calling all the more relevant, I think, and important today for all of us. And he lived that calling. And perhaps the best way to pay homage to that tradition is to actually pass it on to the next generation of Greek Americans. And sometimes that happens intentionally, and sometimes it actually happens unintentionally. A couple of months ago, our 7-year-old daughter, Helene, strode into the kitchen and said, "Mom, I'm taking up civil disobedience." Just what you want to hear as a mom. It feels kind of like the Weather Channel's Jim Cantore showing up on one of these Florida beaches. You think, the attention's in the right place, but I'm a little worried about what's going to happen next. Our children, Helene and Matthew, who are 10 and 8 years old, are learning and learning all the time. And I have tried my best not to be a version of a Greek tiger mom. So I was very thankful when Helene came in this year and she asked to go to Greek school. Yay for Helene. And I'm pleased to report she's doing well. I checked in with my husband. He got her online to help with the homework. And in fact, she's moving forward pretty quickly because she's never had any or done anything, and so she's learning. But recently, I have to say my coaching is becoming less and less helpful because my Greek isn't as strong as it could or should be. And so with a bit of sympathy, last week she says to me, "Mom, maybe you can take the adult class so you can keep up." I've always been proud of our family's heritage, and my grandparents, as Mike mentioned, immigrated from Greece, all 4 of them, and they settled in a small community in West Virginia, a town named Hinton. My mother's family was in another town about 3.5 hours away called Williamson. And my grandfather, like many Greek immigrants, started his own business, and it was a diner after his name, Dionysius, and it was called Denny's. We were first. The others came later. And sometimes as immigrants, you have to find your way to bring your tradition and your heritage with you. And so for us in Hinton, there wasn't a Greek Orthodox church, but we were very fortunate because the Episcopal Church allowed the Greek Orthodox priests to come and either do services and baptisms, and that's how I was baptized. And while I didn't study the Greek language as a child, as Helene is now doing, I most certainly have tried to keep up those values that I was taught and those values of my grandparents. And those were values of hard work, of respect for one another, and of the importance of faith. And these are the same values that have been espoused by our church for a very long time. And they're the values we learn from our church, they're the values we learn from our parents, they're the values we learn from from each other as a community, and they're the values that are shared as part of Leadership 100. And they're the same values that led a member of the Board of Trustees of this group to raise funds for the Hippocratic Cancer Research Foundation. They're the same values that led to members of this organization to run in the New York City Marathon and to stride proudly in a walkathon and raise money for cancer research and for the families that are undergoing a cancer diagnosis. They're the values that Leadership 100 is investing in communities that aren't even very far from here by donating more than $100,000 to help people rebuild in the wake of the hurricanes Irma, Maria, and Harvey. And they're the values that Mike does every time he does make a wish. Yes, I got the letter. And so there are so many acts of kindness and generosity that this organization has helped inspire. And as individuals and as a collective, you all are truly removing yourselves from the sidelines and being a part of the action. And you're living the example that Christ has set for us, and that call from the Gospel of Mark. It says, "For even the Son of Man came not to be served, but to serve." That call to serve has driven many of my choices and our family's choices throughout my life. The chance to serve my nation drew me first into the Clinton administration, as Mike mentioned, when I served with John Podesta and others, and back into the Obama administration. It was the chance to serve people trying to escape poverty around the world that attracted me to the Bill and Melinda Gates Foundation, and the chance to serve communities like my own drew me to the Walmart Foundation. And the chance to serve the next generation is why I'm now at American University. And the through line that sort of ties the stops of my life and the career has been that daily pursuit of that calling, a constant search to find out how to deliver, and that has its roots in my faith. And when we search out the best way to deliver impact, when we judge how well policies or programs work, I found it essential to focus on the facts. And so that's what I'll talk a little bit about as we talk about the issue of healthcare, which I'll touch on today. And when it comes to policy matters, especially the contentious national issues, it's understandable that people are passionate. I can promise you, having worked on healthcare and having more than a few Supreme Court cases have the name Burwell in them, that people are passionate. And everyone has their own individual experience with policy, especially when it comes to healthcare. Healthcare is a collective effort. It's grounded in moments of simple reality for all of us, in moments of joy, like the birth of a child, moments of pain, like a sprained ankle, and the moments of fear or uncertainty, like when a family member is in a fight against cancer. And we count on this system to care for us and to care for our loved ones. And it's such a personal issue, which is why it's incumbent on all of us, especially when you sit in the policymaking seat, to focus on facts on the ground and make sure that our debates are grounded in reality, while at the same time respecting individuals' experiences and their passion. And some of you face that reality every day. You're perhaps an advocate or a policymaker or a healthcare professional, or perhaps you or a loved one is depending on our healthcare system a little more than you might at another time. And healthcare in our country is complex. I like to try and talk about it in simpler ways, but it is complex. And so I want to try and use a simple framework to outline our discussion today. I believe our healthcare system is working well if people can access both healthcare and the coverage that helps them afford that care. Our system works well if people can afford this care and this coverage, and our system works well if the care that the coverage people receive is of high quality. So in framing the conversation, I think of three things: access, affordability, and quality. And for access, overall, between 2010 and the first half of 2017 in our country, the uninsured rate fell from 16% to 9%. And that's historic progress for us, and it's the largest decline that we saw as a nation in the number of uninsured since the launch of Medicaid and Medicare. Second is affordability, which is intricately tied to people actually getting coverage. And since the law was passed, the share of Americans who can afford needed care has fallen, who can't afford needed care, which is a big issue, has fallen by 1/3. So people who say, I can't afford care, that's fallen by 1/3. And for the 157 million Americans who get their health insurance through their employer, and that's what most people do, not all, and I know we have lots of entrepreneurs here who don't do it that way, but the majority of Americans do it that way. Their family premiums have grown at 4.5% since 2010 and 2017, and that's down from an average of 8%. So it's still increasing, and that's what people feel, but it is growing at a slower rate. Affordability also extends to what the taxpayer pays. Having served at the Office of Management and Budget, that's also a point of view when I think about affordability important. And we know that for Medicare, for example, those payments are $473 billion less than they were projected to be over a period of 2000 to 2014. And so that has led to lower rates of growth of the costs. And finally, the third way that we think about our progress often has to do with quality. And whether that's hospital-acquired conditions, when people go to the hospital and they either have a fall or they get an infection in the hospital, we've seen a decline of 21% in what's happening in our hospitals. So that's progress, and also on the quality front is what gets covered. And before the law passed, most health plans in the individual market, so those people that weren't employer-based coverage, that coverage didn't cover maternity care. A third didn't cover any mental health services, and almost 1 in 10 of those plans didn't cover any drugs. So you would sign up for the care, and unless you read closely, you would not know. And so those are improvements in questions of quality. But the reality is there's still a lot of work to do in that access, affordability, and quality. And that's the thing I want to turn to for just a little bit. And there's a phrase that you may have heard that tries to capture the changes that we need to do to work on those things and get better, and it's called delivery system reform. It's a wonky phrase, but it has a simple end goal. A healthcare system that's better for patients, doctors, and our country. And there are 3 areas of focus, or things in terms of where is the system going, what can you do, how do you think about changing it. First, we need to change how we pay for healthcare. In the past, healthcare providers are paid based on the quantity of services they provide, not the quality. And so we need to change that we're paying for outcomes, not transactions. And you need to put incentives in the system to do that. The second thing we need to change is how we deliver care. What does that mean? It means we need more integrated and coordinated care and more focus on prevention. What's integrated care? It means that if you go in for that hip or knee replacement, that the person who's doing your anesthesia and the person who's going to be your physical therapist actually care about what each other are doing, and they consider themselves part of a team for that continuum of care that you will receive. It means helping us prevent more people from getting diabetes. And the third thing we need to do is unlock healthcare data and information. And for many of you, you've probably heard of electronic health records. And right now, as a country, we're in a place where, for many physicians and healthcare providers, they have the difficulty of doing it, but not the benefit, because the systems don't talk, because they're not getting the benefit of that information. And you, as a patient or consumer, are not getting the benefit of that information. So that's the third place that we need to change. And these changes are fundamental, they're historic, and they are actually happening in the private and public sector. And I've been encouraged to see entrepreneurs and the private sector leaders step forward and do this kind of reform. Also, policymakers are stepping forward too. And last year, a number of bipartisan governors, John Kasich, John Hickenlooper, they came together to work on these issues. And we saw Senator Lamar Alexander and Patty Murray come together. And today, I know that all too often in Washington, it feels very broken, as if it's so polarized that it's opened up an impassable divide between folks. But I don't believe that that's true, and I believe that people of goodwill need to face these decisions, and that gap has been crossed before, and we can cross it again. And bridging that gap, though, requires a grounding in some basic values. This brings us back to the beginning, and values that I believe we draw from our faith and our culture. And I'll close with a quotation by a prominent Greek who was unfortunately unable to join us today. We missed him by a couple thousand years. Aristotle once wrote, "A state is not a mere society, having a common place, established for the prevention of mutual crime and for the sake of exchange. Political society exist for the sake of noble actions, and noble actions require noble actors. And from our ancestors and our history as the oldest democracy, we draw on that idea of the citizen, participating fully, actively, and willingly in society. And that's what drew me to American University, the opportunity to support the education of our next generation of leaders, to instill in them a respect for diversity and inclusion, the ideal of free and open expression and debate, and critical thinking, true Hellenic values. And how do we channel these noble actors? How should we define a noble action? By our faith, a willingness to serve one another, to serve rather than be served, to live our lives as Christ has called us to live. And as we leave this weekend, I hope that we will all have a renewed appreciation for our heritage and our faith, and for the great blessings that we have all been granted.